Hi, I'm Dr. Nenika Goyal, consultant dermatologist at Paris Hospital, Gurgaon. Today, we are going to be discussing one of the most sought after procedures being performed by dermatologists worldwide, laser hair reduction, also known as LHR. Laser hair reduction is one of the most commonly performed cosmetic procedures these days. It basically involves a beam of concentrated light which targets the hair follicle and destroys it, which causes reduction in hair growth. LHR reduces or eliminates the need for temporary hair removal procedures such as waxing, shaving, or plucking. It is a safe, effective, and a long term method of hair removal. Its widespread availability these days has made it very affordable, because of which it has become a routine procedure rather than a luxury. Now we are going to talk about what are the different devices which are available for laser hair reduction. There are many different type of energy-based devices available in the market these days for LHR. However, we are going to discuss the ones which are commonly available in clinics around you. The first technology we'll discuss is an IPL, or an intense pulse light therapy, also called as a broad beam light. It is not a true laser, and it was one of the first technologies which was available for laser hair reduction. However, it is an outdated technology. It is more painful, requires more number of sessions, and its results are not as long lasting as the technologies which are available these days in the market. IPL is often available in salons around you and is also available as handheld devices which can be used at your home. However, these devices are not recommended by dermatologists these days. The next is a diode laser. Diode laser has become the gold standard for laser hair reduction procedure. It is highly specific for the hair follicle, and because of which the side effects associated with it are minimal. It is a relatively painless procedure, with patients reporting a pinprick at the time of laser. The downtime is minimal, lesser number of sessions are required, and its effects are longer lasting. There are technological advancements such as SHR, also called as super hair reduction, in which we are able to cover larger body areas comfortably. We here at Paris Hospital have an FDA approved diode machine with both conventional and SHR modes, which is giving wonderful results in our patients. Newer technology include triple wavelength laser, which are available at many clinics these days. Triple wavelength laser emit 3 different wavelength radiations, which theoretically target the skin at multiple levels. However, diode laser still remains the gold standard for laser hair reduction. The last laser we'll talk about is an Nd:YAG laser. An Nd:YAG laser is very commonly used for pigmentary indications. However, there are some cases in which it gives good result for laser hair reduction as well. However, it is less efficacious as compared to diode and is not routinely recommended. Now let's talk about what are the common indications for which a laser hair reduction is done and when to avoid doing it. The most common patient that comes to us in the OPD is the one who wants to get rid of their normal body hair. So it is a cosmetic procedure for them. However, there are certain medical conditions in which laser hair reduction can be helpful for the patient. The most important subset here is a patient of hirsutism. Hirsutism is presence of unwanted male pattern hair in a female. It may or may not be associated with underlying hormonal imbalance. So a hormonal evaluation should always be done in a patient of hirsutism before starting her on laser hair reduction treatment. There are some other medical indications for which laser hair reduction can be done, such as pseudofolliculitis, psychosis Barré, and ingrown hair. However, there are some cases in which LHR is not advisable, such as in very young patients or patients who have some kind of photoaggravated condition, such as lupus. Patients who have active infection at the site of treatment should also avoid getting this procedure done. Patients who have any other pre-existing skin condition or have any cuts or injuries on the site of treatment should inform their dermatologist of the same before getting the treatment done. Next, we'll talk about the time and cost for this procedure. A single session of laser hair reduction can take anywhere from 15 minutes to up to 2 hours, depending upon the area that is being treated. For face, a few minutes are sufficient. However, if a full body laser hair reduction is being done, it can take up to 1.5 to 2 hours. The number of sessions that are required for complete laser hair reduction vary depending upon the site of the body. For thick hair, such as axilla and bikini line, 4 to 6 sessions are often sufficient. However, for your arms and legs, 8 to 10 sessions may be required, and for your face, up to 15 to 20 sessions may be needed for complete reduction in hair. These sessions are done at a gap of 4 to 6 weeks, and after every session, the patient can expect a 10 to 15% reduction in their hair. As far as the cost of the procedure is concerned, it varies depending upon the type of machine that is being used, the expertise of your doctor, and the area to be treated. LHR can cost anywhere between 5 to 6,000 for the face to up to 15 to 20,000 for the whole body. In our next video, we'll talk about how to prep your skin for a laser hair reduction procedure and what can you expect at the time of the procedure and after it. If you like this video, then subscribe to our channel and share this video with your friends and family so that you don't miss an update from us. Thank you for listening to us, and goodbye.